When we talked about earlier in the videos, probably about 90% of my patients will respond to those first two modalities again, which is trigger point injections or neural therapy is what we call that, and then ozone or prolozone injection therapy. Again, that 10% or so patients, who don't respond or maybe respond 60 to 70% of the way, and we still need to get them a little further, then we will kind of step it up a little bit in terms of aggression and moving in the right direction. So ozone is what we call a very anti-inflammatory modality. Sometimes we need to use a little bit of pro-inflammatory modality to get the tissues to respond. Mm-hmm. There is a injection therapy called Prolotherapy. Prolotherapy is a mixture of anesthetic and sugar. We actually use dextrose. Mm-hmm. When you inject dextrose into a joint space, it creates micro-inflammation. What it's kind of doing is basically tricking the brain into thinking you've re-injured the area, mm-hmm. and what your brain does is say, oh, okay, I need to go and heal this tissue. So it's another way to try to get the body to respond. I usually don't start with this therapy because it's pro-inflammatory. There are a lot of patients who are coming in with arthritis or those types of issues and they're already inflamed. I would rather start with something that's anti-inflammatory, see how their body responds, and then if, again, the 10% of those patients need to be more aggressive, then we would go to a prolotherapy, again, mixture of anesthetic and a little bit of sugar. The sugar will create inflammation, get your brain involved into healing that tissue.
So you talk about the joints. Does that include the spine?
Absolutely. So you can inject in along the spine. The good thing about these injections is I never need to go into the spinal cord or into a disc or anything like that. As long as I'm injecting in and around that tissue, the healing cascade will occur in and around those tissues. That way I don't have to disturb the disc or worry about hitting the spinal cord or any of those things. So I do get those questions.
Where the patients
are definitely concerned about where those needles are going, which I totally understand. But the needles I use, again, are not even long enough to puncture those tissues. And I make sure I'm very careful with that when I'm injecting in and around the spine. So when you inject above the spine or in and around the disc, again, the medicine will actually perfuse or go into those areas and heal the tissue. That way you don't have to introduce a needle into that space.